let's go back for a second, because I really want to nail one more thing down before we go forward. How do you make this diagnosis? How do you diagnose sickle cell disease?
Well, in America, it's through newborn screening. So all of the 50 states at this point screen all newborns.
That's a hemoglobin electrophoresis.
It's a,
yes? No?
it depends.
HPLC. I think it's mostly HPLC.
Mostly
right?
HPLC, right?
Yeah, high performance liquid chromatography.
But in your office, if you happen to see an adult who you suspect has sickle cell disease and they weren't previously diagnosed, either they were born before newborn screening occurred in the state in which they were born or they came from another country, then commonly it's a little bit easier to get a hemoglobin electrophoresis, I think, in most
So I'm doing okay if I send
settings.
that out on a grown-up?
You're doing, I think you're doing, I think so.
Well, I guess it depends on the lab, because my institution, if I order hemoglobin identification, will be an HPLC mostly, but yeah, but you can do electrophoresis if you want.
I think one of the points is, first, this screening test for sickle cell that some hospitals have, like the sickle cell prep or the solubility test, do not diagnose sickle cell disease. They may pick up a trait, but they're not specific. And in addition, the disease characteristics in terms of whether there's sickle cell anemia, sickle beta thalassemia, sickle HPFH, or one of the more benign types, needs somebody to really interpret the electrophoresis and do it right, because you will open the door with a single electrophoresis, but you may not have a definitive diagnosis.
Fair enough. And then we come to the NHBLI recommendations for looking at some of these other problems, not just pain, stroke, cardiopulmonary complications, retinopathy. How do you in an ongoing manner, monitor for all of this?
So there are NHLBI guidelines that were released in 2014 that address some really key issues like how to use hydroxyurea. And some of these guidelines are being updated by the American Society of Hematology, and those will come out in the next few months about cardiopulmonary disease, transfusions, pain, CNS disease will all be addressed by the American Society of Hematology guidelines.
All right. Let's take a look then for our purposes. We're not on a heart-lung committee at this point. We're right here with us. No one else is watching, so you can share with me. Your secret's safe. What are the goals of therapy? When you're treating somebody with sickle cell disease, what are your goals of therapy?
I would say two main things. Broadly, you want to improve the quality of life, and then you want to improve the quantity of life. So people want to live longer and they want to live better. So in general.
By the way, those two things are not mutually exclusive.
Correct.
And if you're living longer but worse, that may not be the greatest idea.
That's correct. That's correct. So you want to live longer and better and well. Yeah.
All right. So what are these guidelines recommending then? We said that there are guidelines out there. Are there specifics that the National Heart, Lung, Blood Institute are recommending that are really fundamental to dealing with?
Yeah, I think the key thing about sickle cell disease, like any multi-organ severe disease, preventative intervention will change and modify the clinical course. And what happens for sickle cell often, they don't get preventative monitoring or early intervention that may modify their progression to organ failure. So if you take each one of these organs, you can then intervene using tests or other kind of exams that will predict or likely predict their progression and intervene in a way that modifies their outcome.